Here's another scenario. You have a family member who's on medication and they're insisting that they go off their medication.
Well, that's a tougher one. In my mind, that's actually an easy question to answer. But I know in the minds of many people, many colleagues, it's a tough question because for me, a career that's gone on for almost 40 years now, I've seen the effects of letting people go off their medicine. And the vast majority of the time, it's not a very pretty picture. Once in a while, and really very once in a while, things will go well and one can do it very slowly under supervision. But most of the time it ends up being relapse and what I mentioned earlier, which is called pharmacoresistance. So when the person loses ground at that point, it may be hard or impossible to regain the ground, and the person may have even worse symptoms. So it's very important to do the psychoeducation for that, both with the person and with the family, to say, look, you're hoping for something and I wish I could say that it's going to happen, but the chances are no. Clearly it's an important conversation then to have, not just with the family, but for the person to have with his or her own psychiatrist or other physician or other caregivers, a nurse or psychologist, social worker, whoever's involved with them, to see what makes sense, what doesn't make sense. Sometimes one can actually address this by reducing the dose of medicine, getting rid of annoying side effect issues, changing medicine that cause weight gain for something that doesn't cause weight gain, and so on, and the person can feel much better about continuing to take medicine. However, in people who say, look, I don't really have an illness, this medicine is really never useful for me, you guys are all wrong, we do have in most jurisdictions, in the Western world at least, something called community treatment orders. They're variable depending on the jurisdiction, but they will allow in many circumstances for a person to be treated against his or her will, essentially reposing on the idea that that person, because of psychotic illness, lack of insight, is not able to make an informed consent about treatment, because clearly most people with a psychotic illness are actually able to make an informed consent according to many studies.